Well, good evening, everyone. This is David Berger, and thank you for joining the Digital Health Interest Group monthly seminar. As you've learned from our previous talks, digital health is really important in how healthcare is going to be transformed. And one of the concerns that has arisen from the move towards digital is how it's going to impact healthcare disparities that we know exist. Will digital health actually overcome disparities, or will digital health worsen disparities? So I was really excited when Dr. Messina agreed to give this talk, Overcoming Disparities in Digital Health. And I'm going to turn it over to Dr. Lazar to introduce our speaker today.
I don't believe he's joined just yet. He's joining now.
Jason, are you on?
Hello.
Okay, thanks, Jason. And I'm going to turn it over to you to introduce our speaker for today.
Sorry for any technical difficulties. I've been on. So good evening, everybody. It's my pleasure to introduce Dr. Barbara Messina. Dr. Messina earned her bachelor's degree in nursing from Long Island University. She's had multiple other degrees, including a post-bachelor's degree in adult education, which she received from New York Tech, a master's in advanced nurse practitioner from SUNY Stony Brook, as well as a PhD degree in nursing as well. She then went on to earn a second master's degree in healthcare leadership and simulation at a university in Pennsylvania. Dr. Messina is the Associate Dean of Innovation in the College of Nursing. She has been the Executive Director of the College of Nursing Simulation Center. And I must say, approximately 2 years ago, when the College of Medicine was looking for a new leader for its simulation center, we looked far and near, and the answer was right in our own institution. It was Dr. Barbara Messina. I've had the pleasure of working very closely with her for the last 2 years. She has memberships in multiple simulation societies and organizations. She has been the consummate professional. Her vast experience has provided a guiding light in terms of simulation experiences for our College of Medicine students. And I must say, she epitomizes collaboration, professionalism, and interprofessional education. So it is my honor to introduce my friend and colleague, Dr. Barbara Messina, who will be speaking on overcoming disparities in digital health.
Thank you, Dr. Lazar. I'd like to take this time to thank Dr. Berger personally for providing me this opportunity to participate in this series. I'd like to thank my dean, Dr. Lori Escalier, for encouraging me. And of course, my friend and colleague, Dr. Lazar, who is a leader in innovation, in simulation, and in digital health. And he is currently conducting several studies in wearable digital technologies within the CHS. And I'd also like to thank all of you for coming and participating in this seminar. It's my pleasure to be exploring with you the benefits and the importance of incorporating digital health into Downstate's operations and continuum of care. This lecture will focus on how healthcare providers can assess digital health. A list of resources is provided at the conclusion of this presentation, and this slide deck will be attached to the recorded video that Mr. Worthy will send out. So as healthcare providers, we need to be aware of our own knowledge, skills, and attitudes regarding digital health before we can assess the needs of our patients. And before we get into digital health, I think we need to just do a brief overview of the evolution of medicine, where we were, how we've evolved, and how we've gotten to where we are today. So historically, medicine has focused on the treatment and management of acute and chronic disease. Today, the focus is also on disease prevention. So as such, the form that's utilized by providers to gather that data must reflect our focus. So let's think about that for a minute. So what is that form that we use? It's the H&P. And believe it or not, the H&P dates back to 70 AD to a Greek physician, Rufus. And the paper on the interrogation of the patient is believed to be the first scholarly discussion on the importance of eliciting patient data. That subjective data that we'd say, what's the most important diagnostic tool? What the patient tells us. So the importance of obtaining that subjective data has remained unchanged throughout the centuries. But what has changed is the need to include additional spheres, additional areas of focus, such as the assessment of digital health. In 2019, there was a development of what they call the H&P 360, around comprehensive assessment. And 6 additional spheres were added to that traditional H&P. 2 of them, if you'll notice, I have underlined and italicized, and that's not saying to infer that these others are not important, but these 2 have particular importance to when we're discussing and assessing a patient's digital health. Patients' perceptions of health, goals and values, mental health conditions, behavioral health, social support, and the environmental or physical resources in which the patient lives. 2 of the most revolutionary or technological developments that revolutionized how we acquire patient data. First was the stethoscope. Today, it's wearable digital technologies. Our colleague, Dr. Lazar, who is a world-renowned cardiologist and researcher, is currently involved in investigating and conducting a study on wearable digital technology to acquire data in real time regarding the cardiac status of patients. However, there's 2 main differences between 1816 and the stethoscope and 2022. In 1816, irregardless of your economic background or your social surrounding support, where you live in your environment, in 1816, everyone who sought medical care had the benefit of the stethoscope. However, in 2022, only those with internet access can benefit from digital technology. So let's look at that. And what does that really mean in terms of our patients' health, of healthcare outcomes? How does it impact our care and healthcare outcomes? Healthy People 2030 identified broadband internet access as a social determinant of health. And social determinants of health are factors or variables that can have a major impact on a patient's overall health and quality of life. Other social determinants of health, for example, have been income, education, employment status. Broadband internet access is no longer a luxury, but it is an essential component of disease prevention. Our focus today in medicine, disease prevention and management of chronic and acute disease. Broadband internet access has a profound impact on healthcare outcomes. So when we're obtaining data from our patients, subjective data, the determination of a patient's broadband internet access, as well as their digital literacy skills, is essential. Now, just to shift the focus just a little bit, well, not really shift the focus, bring us back to disparities, right? What's the impact of income and broadband internet access? Poverty in the US is defined as someone who lacks the economic resources necessary to experience a minimal living standard. The most recent statistics I could find, 37.2 million people in the US were living at or below poverty. That's an increase of 3.3 million from 2019. A social determinant of health is broadband internet access. This survey was conducted by the American Medical Association in 2020 and the Pew Research Center in 2021. And if we look at it, we can see the relationship between income and digital health. 24% of those who are living at or below poverty do not have a smartphone. 24%. 43%, that's 4 out of every 10 adults living in America, do not have broadband internet access. 43%. Think about when we're assessing our patients. Do we ask them, do they have broadband internet access? Does the H&P that you're currently using, does it have that question? Is there a tool that you're using to assess their digital health? 41% of those at or below poverty do not own a desktop or a tablet. 41%. If we look at our statistics in Brooklyn, 37.3% of the individuals in our community that surround Downstate University Hospital, an academic medical center, 37.3% of those individuals are at or below poverty. If we reflect to the statistics that I just discussed, 43% of people who were surveyed throughout the United States, 43% at or below poverty don't have internet access. 41% don't have access to a laptop. 24% don't have access to a smartphone. 37.3% of our community members are living at or below poverty. So what do? We need to assess our patients' digital health. How do we do that? How do we assess our patients? We assess our patients using standardized tools. And a standardized tool is a valid and reliable instrument that's been tested and developed in order for us to assess our patients and assure that we are looking at all of the key elements that are included within the phenomenon that we're looking at, right? So standardized tools are the foundation for evidence-based assessment. An evidence-based interprofessional assessment is what is needed and imperative for interprofessional patient-centered planning and management. Now, what I'm going to do is review with you resources that are available for us to utilize, resources that we can send our community members to, and strategies that can be employed to help reduce those disparities. We want to equalize and provide everyone with access to digital health. Public libraries. Public libraries are an invaluable resource. And public libraries provide free digital literacy training in addition to their regular services. All public libraries provide free digital literacy training. The Agency for Healthcare Research and Quality, the AHRQ, when I was researching this and looking for standardized tools, provides a massive toolkit that you can look through. And I've provided you with a link to the AHRQ, to the digital toolkit, as well as links to all of these tools that I'm going to discuss. So the first is, what's the patient's experience and expectation? Has the patient, this is a questionnaire that's been designed to be completed by patients in the home care setting. Because one of the things that they say with digital health and digital technology, right? If we increase communication with our patients, we can increase our teaching. We can have greater access and assess and provide a constant continuum in assessment and evaluation, restructure our patient-centered care plans to provide patient-centered care. So what's the patient's experience? What's the patient's expectations? Do they have realistic expectations? What's their experience been? Do they feel positive or do they feel negative? If they have not had a positive outcome, they're not going to use it. But what we need to do is not just gather the data and say, okay, well, they did not have a positive outcome. But why? Think of our Press-Ganey scores. What is it about the experience that did not provide you with a positive outcome, or didn't meet your expectation? In that manner, we can gather that data and make changes. Computer literacy skills assessment. Again, this is a questionnaire that's been designed to be completed by patients in the home care setting. You know, are they able to access their patient portals? You know, are they not accessing a portal because they can't? We can't make any assumptions. We can't, just like we can't make the assumption if we send a patient home and we've provided them with education. I'm a recovery room OR nurse. We call the next day to see how they're doing, you know, because we've given them written education. We can't make the assumption that they understand it and they're following it. We can't make the assumption because they haven't accessed the portal that they're just not interested and they don't want to. Maybe they can't, even though they've gone to we've sent them and they've attained these literacy skills. Now they've come home and they don't know what to do, right? Even us who have, you know, varying degrees of technology, and we've used it and we've experienced it, you know, sometimes technology has a life of its own. And maybe there's some technological issue that has nothing to do with the patient, but the patient feels, well, I can't do it and I just can't access it and I don't know what's going on and this just isn't for me. So we need to find out, why aren't they accessing the portal? Are they able to access the portal? What's their assessment of our website? Is it not intuitive? Do they find it confusing? Are they not able to find the portal? What is their perception about secure messaging? We hear about breaches all the time in large corporations. How does the patient feel about having their personal health care information shared over the internet. Could that be a barrier to why they're not using it? And what can we do to educate them? Again, this is a different type of questionnaire to assess an individual's confidence about performing computer and internet tasks. This tool was specifically designed for us, for healthcare providers. What do we feel? We have certain needs that we look for when we're accessing electronic medical records or emailing information or data mining. And we provide this to our informatics team, but computers have, there are limitations. And what they're doing is they're listening to us and they're developing this tool of what they think we want. Are we satisfied with the electronic tools, with the digital technologies that we have in our own institutions? If not, do we have communications? Is there a committee? Is there the ability to discuss what our needs are? The one thing I did find that needs to be emphasized here is that the tools that I found in the AHRQ, I did not see them translated into other languages. So whatever tools that you decide to use, they would need to be translated by a medical interpreter. And then once that translation has occurred, that you make sure that you conduct a pilot study to see that while they've been translated into another language, that they're still valid and reliable. Because we do have a diverse population of patients in the United States, in our population. And we want to make sure that we are capturing patients not only with English as a primary language, but English as a second language, or maybe they don't even speak English. Let's get back to poverty. Let's get back to economics. It all boils down to the dollar, right? Multiple studies have found that the greater the income, the greater the educational level, the greater the, the better access we have to quality health care. So recognizing that broadband internet access is no longer a luxury, but it's a social determinant of health. The Federal Communications Commission has developed affordable connectivity program to assist to provide affordable broadband internet access where needed for work, school, and healthcare. So having the wonderful healthcare, interprofessional healthcare team that we have at SUNY Downstate, our social workers are invaluable members who can provide the assistance in helping our patients attain financial support in order for them to get broadband internet access. Dr. Lazar is doing cardiac studies. You have cardiac patients. These patients are not going to be able to reap the benefits of having real-time cardiology status read out, delivered to a physician, and where the physician can then contact their patient if they don't have broadband internet access. In 2020, and I just actually looked this up just before this whole thing started, it has not passed through Congress yet. Congressman James Claiborne of South Carolina, he introduced a bill into Congress to establish affordable broadband internet access to all Americans. To all Americans, because it is no longer considered a luxury. It is a social determinant of health. And 43% of Americans do not have broadband internet access. So how do we help reduce these disparities? What are some of the things we do? We need to have interprofessional collaboration. Just when a patient presents to the emergency room for a disease problem, it's multifactorial. There are multiple variables that go into patient developing acute or a chronic disease. Digital health, inequities in digital health, is also multifactorial. And what we need is we need our interprofessional healthcare team to collaborate to ensure that we reduce these inequities in, in disparities in digital health. We have to work together as a team to provide our patients what they need to improve our patient healthcare outcomes. And finally, advocacy. We need to advocate. We advocate for our patients every single day at the bedside, every day. We now need to take that advocacy, bring it up and bring it out into the community. Advocate for community resources. Do we have community senior centers? Advocate or lobby your legislative representatives. We are the largest single workforce in the country, healthcare providers. We could change the face of this country in one vote. Advocate that our patients have broadband internet access, that they're provided with a smartphone, with a tablet, with a computer, so they have access to digital health. Lobby your professional organizational bodies. That we need to lobby, we need to incorporate the assessment of digital health into our H&Ps. Because without it, we're not giving our patients a broad and comprehensive patient-centered plan of care. What are our own institutional policies and procedures to support digital health assessment? And as educators, we're in an academic community. And as educators, we need to incorporate this information into our curricula to prepare the interprofessional healthcare team. So here are the references I will go through, and then I'd like to pose some questions. And these will be provided to you. They'll be posted up when Mr. Worthy sends out this recording. So some questions I'd like to pose to you is, what have you noted in your institution regarding digital health? Is it incorporated into your overall patient assessment?
So people can put in comments in the question and answers, but I'll start the conversation. And your point about broadband internet access is very, very critical. You raise the issue of the HCAPs, et cetera, and we have a very, very poor response to our HCAPs, and it's likely to be because a lot of people don't have internet access. Additionally, we have found that a lot of our patients do not want to engage in telehealth. They will engage with us on the telephone, but not in visual one-on-one interactions. And we don't know if that's because they don't do or do not have broadband internet access. So that's a really important point. There were some comments here. Dr. Youssef said, yeah, we don't ask about broadband internet access. Great point. Mark Schwartz, I found it to be more passive by watching the patients play with their mobile phones. If anyone wants to chime in, Dr. Kaufman, looks like you're up. If you'd like to add anything to this discussion.
Sure. I think it's a really important discussion, and thank you for that, Dr. Messina. I think what I'm saying is probably known to most of us. So it's a multifactorial problem, as actually Dr. Messina was arguing. So I think it's partly a cultural change on both parts. So I think our patient population for the most part have been socialized not to engage digitally. It's not part of their orientation. And so that we have to bring about some kind of change that's very challenging, as well as on our parts. I'm not a practicing physician. I'm not a physician, in fact. But I know that there's a need for a cultural change to think about that, to think about digital capabilities being part of that. So there is various aspects of engagement. You referenced usability. I think usability is a really big challenge. I haven't checked our portal very recently, but I know that it was lacking in significant respects the last time I did. So maybe there's an opportunity for us there to begin by really incentivize patients to visit the portal, even for small things, scheduling, prescription refills. Those are things that have proven to be very popular. And finding different ways to engage them along that front, I think that might be a useful way to start. Thank you.
Thanks, David. Dr. Messina, there's a comment asking about differences in older adults. You spoke a lot about income levels and broadband internet access and willingness to use digital health. What about older adults? Is this an issue also?
Yes, thank you for the question, and thank you, Dr. Kaufman. Yes, to answer your question, yes. And that's why one of the things we need to do is to assess our elderly patients with their digital health and to recommend that they, suggest they go to the libraries. As I said, that the all public libraries have, they'll teach digital health and, digital acquisition of computer skills, and it's free. So that's something that we can suggest to our elderly population. So I mean, I can speak from my own family, and my mother-in-law is like 95. And for her, the use of the computer is just not something that she would, even entertain. So I think that's something that we also need to include when we're assessing our patients, is not to make the assumption that they will use digital health, that not everyone is going to use a digital technology. Maybe they don't want to. Maybe it's just something so foreign to them that they don't want to. So we need to if we're making an interprofessional patient-centered care plan, that we have it where if the patient says, no, I don't feel comfortable with that. I don't want to do a telehealth. I don't feel comfortable making an appointment on the internet, that we, can easily acquiesce and say, okay, that's fine. You can call and you can make an appointment, because we have to do what the patient's going to be, feel comfortable using, right? The greatest failure for care plans for patients is that we've made all of these grandiose care plans, and when we review and assess them and evaluate them, we sort of forgot to kind of include what's the patient's perception. How do they feel? How does it make their needs? How does it meet their needs? So the elderly population, absolutely, and the public libraries and senior centers. When I contacted the called my own public library, and I emailed the American Library Association, and they will come. A librarian will come if you request it to a senior center. So if a senior center, requests a librarian to come, you can set up, digital skills days and have patients come.
So there, in response to that, Dr. Christini said, I think it's unrealistic that many elderly people will go to the library for this. I think it's on the software developers and portal developers to make it super easy to connect to and join the video appointment. My father-in-law missed a telehealth appointment yesterday because he couldn't figure out how to connect. It has to be one click from a cell phone. And a related comment, Dr. Messina, was about using cell phones, mobile smartphones, versus needing to use a computer. Can you comment on those two issues that were brought up?
Well, I agree with her in that many people may not go to the library, and that it is one strategy that can be employed. In what would be terrific if we do have, and as we go on, if we can have something like we have at the bank. It's very easy, yes, no, and anyone can make a deposit and take out the deposit. If we can have that development on a cell phone, or on the internet. In terms of a tablet or a computer, ideally, it would be wonderful if it could all be on a cell phone. My concern with some of the problems, I think that a small tablet would actually be better than a cell phone because it's bigger. So if you sometimes it's very difficult to read the cell phone and to manipulate around on the screen on a cell phone. So I think that if patients could be provided with a tablet, I think it would, would increase the usability and increase the friendliness of having a platform and having the patients access one click into a telehealth visit or making an appointment or, renewing a prescription.
So one thing I'd like to comment on is actually the other side of this coin, which is the providers. So you've brought up a lot of things in terms of providing patients with broadband access, giving them tablets and phones, but a lot of the hospitals that serve this population are safety net hospitals with very poor economics and poor funding. So my concern as someone who runs one of these hospitals is our patients fall further behind because we don't have the resources to be able to provide our patients with access, with smartphones, with tablets, et cetera, et cetera, et cetera, as opposed to other systems that are significant wealth, have significant more resources, which continues to compound the problem of disparities in this population. I'm not asking a question, I'm just making a comment that that's one of the big things that concerns me. So in terms of creating these really patient-friendly portals, being able to reach out to our patients in an easy format, this costs a significant amount of money, and we lack a lot of the resources to be able to get this done. So that's the other side of this coin. So it's a huge problem and a major concern that I have. Is if Dr. Lazar is still on, I know Dr. Messina has mentioned his work a couple of times. It'd be interesting to hear from Dr. Lazar what the uptake has been and the ability to monitor these patients remotely using wearables.
So of course I'm still here, and thank you. By the way, I just texted in the chat that I would actually advocate for some perhaps lesser expensive solutions as well. In the era of COVID right now, we are seeing patients in person for a first visit. And I often wonder whether we would be able to actually set them up and train them on their cell phones for future telehealth visits, which is essentially the practice model that we've recently adapted during the surge of Omicron. Twice this week, I had patients that I had difficulty understanding, and these were in-person encounters, how active they were. And as I wrote in the chat room, I asked, both happened to have an iPhone, and I showed them the icon with the heart on it, looked at the steps, and neither one had realized that their daily step count had been logged probably for years. One was 3,700 steps a day, and remarkably, one was 86 steps per day. And I pointed out the usage of the step counter. And look, I understand it's far from perfect and it's a crude measure and there's all kinds of, issues with it. But I'm hoping that these two patients, one at a time, and that's how you build a practice. And I think that's how you build digital health, will, hopefully motivate each patient to become more active. And maybe January and February during the cold months is not optimal, but hopefully this can go on, and really have them, build upon their activity during the warmer months, which are hopefully to come soon in April and May. I'll comment on David Berger's question, and that is, what about wearables? I think the big issue with wearables in digital health relates to the fact that each wearable, whatever it is, whether it's a monitor of some sort, whatever it is, has its own platform. And I think the big problem here is that they don't link very readily to electronic medical records. And so you have to go online, or to some platform to better understand the results of what is being monitored, and then somehow, some way be able to merge it with the electronic medical record. I mean, one of the most, I think, frequent examples lies in home blood pressure monitoring. This is a technique that has been shown to be superior to office blood pressures. Patients who take their blood pressures at home are way more engaged and do have better blood pressure control. And home blood pressures are more strongly predictive of adverse outcomes than those taken in the office. And yet, what do we get? We get either this log that's then sent to us, which we have to alpha scan and put into the electronic medical record, or have to access some website in order to download whatever it is. So I would view that as the major hindrance here. And like digital technology in general, it's institutions that ours that take care of lower socioeconomic status patients that are disadvantaged in this regard, because we don't have the resources to provide patients with the technologies, or train them with the technologies, or be able to adapt these ancillary wearable sets of data with our electronic medical record. Those would be my comments.
Thanks, Jason. And you can see from all the chat, all the comments on the chat and the questions, that this is a really important issue for us. And I'd like to just comment that I think in our IPE, as we continue to evolve our interprofessional education, this is an important area to incorporate into our interprofessional education, as well as this presents a large opportunity for research for us, since it impacts our population so greatly. I would really encourage people to start thinking about how we can incorporate it into our education of our students and our residents, as well as begin to develop research around the issue of disparities in rolling out digital healthcare.
Hello. And if I can speak.
Go ahead, Dr.
Hi, hello. I'm a marketing consultant for several programs for SUNY Downstate, especially the START program. I think that one of the major factors, I've been studying a lot of wearables and all the software that I can find about that link medical and not just the patient, also, the provider. And I think education is one of the main factors that it plays a humongous role when it comes to wearables or cell phone. Just as we go to see our doctor, it's important that if we are or the patient has access to this. I think the setup it should be first like a patient visit to the doctor. It should be done at the office. Now I know that, for example, follow like my chart or follow my health, they can link and you can grant permission, for example, on an iPhone to the health app to share your steps or your heart rate or any other wearable or technology that you can permit to use. But education is very important because it's still like a weird cloud for so many people, and the lack of information is one of the main things. Differentiating from the lack of opportunity of people having or granting access to these devices is also the lack of material, of information material that will help, especially our seniors, that is patient, that is a whole different world. You know, our millennials, they're more, you know, up to the game. But the lack of informational material, educational material, and also probably incorporate into our business how to use or how to connect or how to set it up right in the doctor's room, it will be as important as most of the things that we discussed today.
Thank you for those comments. Anyone else that would like to comment?
Dr. Berger, this is Mahfuzur. If I could say a couple of words.
Please.
Thank you for the opportunity for this forum and for Dr. Messina's presentation. Very timely and a phenomenal presentation. I mean, we all talked about this, and Dr. Berger, you mentioned it. It's like a vicious cycle, and our patients don't have the knowledge, the equipment to be informed about their conditions, about the treatment options. So they depend on us to provide them with it, to be on par with other patient populations, other institutions. As providers, we have to devote more time and resources, and we don't have that. So we are in this vicious cycle. And looking at the patient portal, I am very easily able to make appointments with my doctors through the phone, apps, and so forth. Our patients don't. And they already are at a disadvantage with social determinants. If they should go to doctor's visit physically, they can't go. So they skip a visit. Then they walk into our clinics. So our no-show rates are high. And then our walk-in rates are higher than many other institutions. We accommodate our patients, but that puts us at a disadvantage where it's unpredictable how many patients will show up today. One day clinic is light, next day is very busy, and therefore it's hard to provide adequate attention and care to our patients. Downstate is in a place, like you mentioned, is a critical care access hospital. So what do we do now? Other than changing the law and waiting for the politicians to change things, what can we do to help our patient population, help SUNY Downstate, help our neighbors, our community members? What can we do to help everybody so that healthcare will improve? And it's not going to improve overnight, because I'm sure our patients are not going to win the lotto and immediately they'll become proficient on technology and digital health in general. But what are things can we do? Can some easy things be done sooner than later? EHR is our medical record. If I ask my patient, do you have internet at home? I get looks from them. Why are you judging me? Why are you asking me that question? They're embarrassed maybe. They think I am profiling them somehow by asking those questions. It's hard to get that information from patients. As a provider, what are we to do? I would like to hear from panel, from everybody on the call, about how to assist our providers so that we can get into a position where we can actually be fair, so that we can help our patients and do a better job taking care of them.
I would say, Mafusa, to that problem, maybe we have a focus group of patients and ask them how to ask that question. It may be the hierarchy of how we're asking that question, rather than there might be another way of asking it, which would be more culturally sensitive. So I think that's the way I would approach it. But it's another, like I said, this is a huge opportunity for both education and research. And I think we need to put our heads together and figure out how we can get the information better in order to serve our patients and the people in our communities better.
completely agree. And I think we have several meetings, forums going on. We're going to do that, but it's a big challenge, and we all recognize it, but it's hard to come up with solutions for these major problems for our patients and for our staff, because people get frustrated. Our providers get frustrated seeing the same patient with the same problem every time, and nothing is changing. But thank you very much.
So, Dr. Messina, are there any concluding messages that you would like to provide? Obviously, this was a very provocative talk, some very exciting opportunities that have come out of this, some things that I've thought of that we can better serve the patients who come to our hospital. But can you wrap up for us?
Absolutely. Thank you, Dr. Berger, and thank you to everyone for attending and participating. And it is it's extremely challenging, and there are so many variables that factor into this. I think that, as Dr. Berger suggested, I think one of the first things we need to do was, again, go back to our patients. How do we ask these questions? How do we find the information? Once we have that information, then we can develop strategies and interventions to help increase it. I think Dr. Lazar brought up again, as he always does, a brilliant point. You know, patient by patient as they come in. Patient may not even know that they have the smartphone, and yet they were being monitored. They may not even know they have it. They may not even know how to use it. So we can start patient by patient. And of course, there's some things that are just, I agree, that are just beyond anything. Here we thought we were going to have these electronic medical records and would be able to transfer information, and it will cut down on problems and increase communications. And yet we find ourselves in this position where A doesn't communicate to B. So I don't think there's going to be any easy solutions, but there never has been easy solutions. But as healthcare providers and people who really want to make a change and are committed to serving our patients and our communities, I think if we come together as an interprofessional team, that these barriers and challenges can be assessed and strategies can be developed. And I look forward to continuing to work in this area and collaborating with everyone at SUNY Downstate.
Well, thanks, Dr. Messina, so much for this talk. Chris Worthy, if you can also save the chat and post it to the site where we're going to have the slides and the audio portion of the presentation, that would be great. And more to come. And please look in your email inboxes for next month's talk. We continue to have really stimulating talks around digital health. And if you have any suggestions for other talks, please reach out to me directly. If you would like to speak in our seminar series, we'd also welcome anyone who wants to speak on any topic related to digital health. It's just, was a great talk to kick off 2022 and help us think about what we need to do moving forward. So thank you so much for participating this evening, and everyone have a good night.